Good morning. I'd like to welcome everybody to the meeting of Gloucestershire Health and Wellbeing Board on the 22nd of September. Welcome to the meeting. We're slightly late starting for technical reasons. I'd like to begin the meeting by handing over to Andrea Clark to give an account of some potential governance issues we have for this meeting. Andrea.
Good morning, Board. Just to let you know that as we currently are, we are not core. For the Board to be core, we need at least 4 voting organisations to be at the meeting, and we have nobody from the police or the Office of the Police and Crime Commissioner, and Health Watch Gloucestershire haven't come online yet, and NHS England won't be attending. So what this means in terms of going forward, the meeting can proceed, but I will be producing notes of the meeting as opposed to minutes. You're not making any significant financial decisions today. It's about moving work forward so that this does not present a problem in terms of addressing all of these agenda items, which actually do need you to keep them going. And I'll keep an eye out, and if I see Health Watch coming in, I will interject and let you know that we are now core. Thank you, Chair.
Thank you very much, Andrea, for that clarity. So with that in mind, can I look to Andrea for apologies of absence?
Yes, we have quite a few apologies today, Chair, hence the issues around the core. We have apologies from Councillor Cathy Williams. We have apologies from Councillor Richard Boyles, and Councillor Andrew Miller is substituting. We have apologies from ACC Rhiannon Kirk, from Chris Briley, the Deputy Police and Crime Commissioner, from Darren Knight at Cheltenham Borough Council, and Richard Gibson is substituting for him. From Margaret Wilcox, who's the Director of Adult Social Care, from Wayne Bocock, the Chief Fire Officer, and Gavin Roberts, Deputy Chief Fire Officer, who is substituting for him. We have apologies from Dr. Teresa Pietroni, who is the Primary Care Representative. We have apologies from Anna Brinkoff at Gloucester City, and John McGinty is substituting for Anna. And I've just heard that Chris Spencer may not be able to attend due to Ofsted reasons. And I can actually now update the Board to say that we're now core because Nikki is at the meeting.
Good. That's really good news. Welcome, Nikki.
Hi, sorry about that. I was actually waiting on a different computer, and although it told me I was in a queue, nothing happened. So I've got about 3 computers on the go, so I might be a bit of a maniac.
Thank you, Nikki. I'm glad you're able to join the meeting. We now move to declarations of interest. Andrea, do we have any? Members, do we have any?
I haven't received any, Chair.
No, thank you. Minutes of previous meeting are held on pages 1 to 4. So page 1. Page 2. Page 3. No, okay. Andrea, can I come to you for action points on those?
Sorry, Chair, you caught me on the hop there. I was still receiving messages about people trying to get into the meeting, so please bear with me. I think everything that we had discussed at the meeting and had actioned has been addressed. I sent an email yesterday to update people on whether the social value policy, and obviously we've got Jennifer Taylor online today to talk about the update on the working group. And the priorities are obviously here to be discussed this morning, Chair.
Thank you very much, Andrea. Can I ask members if they agree to those minutes being signed off? Yeah. I have general agreement there. Thank you very much. So we now move on to item 4, which is public questions. And I understand there are no public questions.
No public or member questions have been received, Chair.
So that's item 4 and 5. Thank you. So we move on to item 6, and it's an invitation to Sarah Scott to give us COVID-19 update.
Okay, thank you, Chair. So I'm just going to share my screen to talk you through a couple of slides to give you an update. So hopefully you can all see my screen now, which should say COVID-19 in Gloucestershire Weekly Data Summary Week 37. So I'm assuming you can see all that.
We can. You need to expand it, Sarah. We can see it, but we've got the small view.
Is that better?
Yes.
Okay, right. So, oops, bear with me. So the first slide talks about an update for the week beginning the 7th of September. So all of our data obviously has a slight lag to it. This week we were seeing 59 confirmed cases in Gloucestershire. You'll all be aware of some of the issues with testing at the moment in Pillar 2, where you can go on the online portal and access a test either through the post or through the mobile testing units, or through or via the testing centre at Hempstead Meadows. So a lot of the testing capacity is being diverted to other parts of the country, kind of seeing the outbreaks at the moment. So it's taking a longer time for a test to be processed. So it's taking a long time to get a truer picture of our confirmed cases. So what I can tell you now is that in this particular week, when we actually had 65 confirmed cases, not 59. They were spread throughout the county, but we are seeing high numbers of cases in Gloucester and Cheltenham, that urban corridor that goes to the middle of the county. You can see there our epidemic curve in the middle of the screen in the green, and our total cases now are 2,190 as of the end of yesterday. And you'll notice that the news reports recently that the epidemic curve for the rest of the country looks slightly different. It's got a much higher peak at the end. And I think it's good that we are seeing a relatively low number of cases, but there is certainly an increase. There's work for us to do. So this chart just talks us through our recent number of infections. And as I said, we're slightly out of date because we're getting new testing data through all the time. So week 37 was actually 65 cases. And last week, the 14th to the 20th, it's now running currently at 48 cases. And out of the 48, we had 18 situations, and we class these as places where there are high risk people or high risk activities. So care homes, schools, workplaces. So we had 18 different situations last week. That's also increasing week on week. Mortality, so you would have heard me talk about very slightly the deaths from COVID in the past, and we've had 586 deaths across the last 6 months. Thankfully, we haven't had a death in the last week, which of course is really, really good news. We had the start warning on the news yesterday from Patrick Bannett and Chris Whitty about the projected number of deaths in the next 6 months if we don't take alternative courses of action. So what we're seeing at the moment on this graph is that the number of COVID deaths has reduced to 0. And for the last week, but we are seeing actually as our non-COVID deaths around the seasonal average, which is good. Data is available publicly. So this slide is available publicly on the COVID page on the .gov website, and it identifies where we are seeing increasing numbers of cases. And so what we want to see is Gloucestershire being a pale blue or a white, which indicates low numbers of cases in medium super output areas. And there are 75 medium super output areas in Gloucestershire. And these are areas are a bit bigger than a ward. And you can see there the areas that have had 3 or more cases. And then finally, the R value. Nationally, the government has moved away from relying solely on the R value, but we know the R value is increasing in certain parts of the country. Because of the relatively low numbers of cases we're seeing in the southwest, then we need to be careful how we interpret any subtle changes in the R value, but it is an indication of how many people are passing on the disease. So I'll pause there, and I'm happy to take questions. What I might do is switch off my camera because I think that affects the sound quality on my laptop. So happy to take questions.
Thank you, Sarah. Do we have any questions from members? I think, and I'm relying on Andrea and Sarah to monitor what they're seeing.
At the moment, Chair, I can't see any hands up
on
the system.
Thank you very much, Andrea. Sarah, thank you very much for your presentation. There are no obvious questions needed to be asked at this point, but I'm sure people will get back to you individually if they have them. Thank you. So we'll move on to item 7 on the agenda, which is part of the Gloucestershire Joint Health and Wellbeing Strategy priority areas. This was a set of items brought forward from last meeting, and leads in these areas have come forward with their papers. So really exciting to see these. I'm going to make the assumption that everybody has read them. So I'm going to ask each of the presenters to actually just talk for perhaps 5 minutes, no more, on key issues they want to bring to our attention. And then we'll open it up for about 5 minutes worth of questions. So to kick us off on this, on item 7, which is physical activity, pages 5 to 10, we have Dr. Andy Seymour. Can I remind people, if you're not talking, to actually mute, because I'm getting lots of lovely sounds coming back to me. I think it's a coffee percolator. Andy.
Chair, thank you very much. So, as Carol says, I assume that people will have had a chance to read the paper. Apologies, my paper wasn't formatted in the usual way. The report is responding to the brief. So, having said that, I hope it's fairly self-explanatory. And I'll just pick out a few highlights from the report. Right at the very beginning, a reminder that how important physical activity is. A previous Chief Medical Officer, Dame Sally Davis, said, if physical activity were a drug, we would refer to it as a miracle cure. And absolutely right, physical activity is hugely important. And in this county, we've got a long history of doing some work and investing in delivery of physical activity through councils and charities, and done lots of different work across localities. However, there is a tendency to find these almost sort of like at an individual activity level, and we've not really made a sustained, coordinated county-wide effort to shift population levels of activity. So beginning in 2015, we started as a partnership across the county to look at and develop a social movement in which being physically active became the social norm. And this partnership was called the We Can Move programme. Now, We Can Move, which is formerly known as Gloucestershire Moves, is about encouraging and supporting people to increase their activity levels through a whole system approach. So it includes sport, informal physical activity, transport and design. And it's also about looking at reducing barriers to becoming physically active at various levels. So at an individual level, and the way people act on a day-to-day basis, at community level, passing ownership to communities, and at system level, so where overarching system barriers exist, the overarching system can therefore lobby and look for direct action. And that's where the Health and Wellbeing Board, I believe, should have influence, and that's the importance of our link into this kind of programme. So I say the overarching aim of the programme is that it becomes a social movement owned by the people. And we all know the huge benefits that would bring if we become more active as a county. Definitely more positive health benefits from both mental and physical health perspective, but also better and more cohesive communities with knock-on effects with economic benefits and the like, reduction in social isolation and loneliness. So as I say, it also links to other Health and Wellbeing Board priorities. It will have a knock-on effect on reducing obesity, social isolation, and also have an impact on adverse childhood experiences as well. In terms of funding, the We Can Move programme is co-funded by Sport England, CCG, County Council, District Councils and other partners as part of a 3-year test and learn pilot. And this began in 1819 and its current funding is due to end in March 2021. So currently a business case is being developed to take this further, with the idea of going for another 5 or 6 years up to 25, 26 at a rate of about 150,000 per year. It's pleasing to note that Sport England have committed to continue their funding in their own latest draft strategy. That funding will go right the way through to 2031, so that's very helpful. The We Can Move strategy is about to be refreshed and republished, and it's out for consultation in the next few days, actually, and will be available on the Active Gloucestershire and the We Can Move website. So I encourage people to look at that. We can always send on links if required. And if you will have seen Appendix C, the last appendix on the paper, which shows the areas of need, the areas of priority, and unsurprisingly, that's where the We Can Move work programme concentrates on. So looking at people, older adults, disabled people, children, young people, people from disadvantaged backgrounds, people from BAME background, and also a place-based approach. And there's been some really good work, which again we can send on in places such as Barton, Treadworth, and it's been really good work looking at a small group of women coming together to learn to ride a bike and cycle. And that's a reminder to us all, perhaps certainly to me, that of course we take it as a given that people can ride bikes, but there are people in our population who don't, and this has been a really good bit of work. It's important not to forget the impact of COVID at the moment. Clearly, that's had a negative effect on physical activity with lockdown, obviously, and perhaps the coming months that people are less active. And inevitably, it's those people who are more disadvantaged in our society who are going to suffer most. So we certainly need to be mindful as both as a health and wellbeing board, but also the work programs that we can move to look at the impact of COVID in particular. So just to summarise then, so We Can Move is a step change in approach to addressing levels of inactivity in the county. And programmes and interventions have been co-created and organisations have worked in partnerships to test and learn together. And We Can Move offers the potential impact widely on Gloucestershire's health and wellbeing system. As I say, to look at increase in physical activity and therefore have an impact on obesity, social isolation and loneliness. Thank you, Chair.
Thank you very much for that summary. I appreciated the short paper, and I particularly appreciated the appendix, because for me that sums everything up. And I'm pleased that we're going out for consultation in September, so I would ask members of the board and others to respond to it. Can I invite members of the board to ask questions if there are any that come from this paper? I can't see anyone indicating. Andrea?
Not currently seeing anybody indicating at the moment, Chair.
Okay, can I ask board members then to indicate that they are happy to receive the paper and will hopefully inform their budget process to actually allow funding to be continued, if not increased? Seems to be general agreement there. Okay, thank you very much. Coffee percolator back on. So thank you, board. Thank you, Andy, for your paper. Really well received. A very informative piece and such innovative work. And as someone who's never been able to ride a bicycle, I might come and join your group. Thank you. We'll move on to item 8, which is a priority, which is ACEs and resilience. Andrea, do we have anyone to present this? Because I understand Rhiannon has given her apologies.
Yes, Sarah Scott is going to present this item, Chair.
Thank you very much, Andrea. Sarah, over to you.
Thank you, Chair. I'll switch off my video because I think it might be easier for you to hear me.
Thank you.
Okay, so I'm assuming you've read the paper. I think this is, I suppose, one of our priorities of which I'm most proud. I think it's been 3 years since we had our first meeting around ACEs in the council chamber in Shire Hall. And following that, we convened a panel chaired by the then Assistant Chief Constable for Gloucestershire, Julian Moss. We drafted a strategy and the board approved that in November 2018. And we used the theory of viral change, which was a very different approach for us in Gloucestershire. And I think it has really paid dividends. We had our first conference in June 2018. And sadly, we had to postpone our conference in June this year due to COVID. But I think it really, really quickly gained momentum. And we have funded this social movement really on a shoestring. I think it just goes to show that how we use a different approach, it can have quite a tangible impact. Our next conference is planned for next year, and we were planning to launch a refresh of the ACEs strategy at the conference this year. I think one of the themes, I suppose, with ACEs and with Healthy Weight is my team provide a lot of support for these priorities, and they are now completely consumed by COVID response. So our work on ACEs stopped 6 months ago, but the panel is meeting for the first time on Thursday, which is really exciting. And we have a new chair, the former Chief Executive of Cheltenham Borough Homes, Paul Stevenson, who's been a panel member for quite some time and is really committed to the ACEs agenda. So we're hoping to get back to refreshing the strategy sometime after Christmas. And I'm confident that, we've still got the commitment and the momentum within the panel, and you'll see from the paper that we have 130 ambassadors around the county who have continued throughout COVID to carry on the work of the ACES panel. And you'll see in the paper we talked about some of the metrics that we've used to try and understand the impact we've had. And people are still reading the newsletters, whilst the events have stopped, but we think the work is carrying on, which is really, really heartening. I think there'll be a theme today. I think there'll be, I'm just seeing that Andrew Miller still can't hear me. The headset doesn't work for me on WebEx, which is why I don't use it, but perhaps I'll have to try and get another one. So there's a theme about funding. So the funding for the ACES posts is coming to an end. This has predominantly been met by either the police or the county council. So we found half of the money from the county council, but I think we might need a more strategic conversation about how we're going to fund some of these health and wellbeing priorities going forward. So the posts come to an end in May next year, and they've been really instrumental in driving this work forward and having some dedicated support. We found some extra money for a comms post because I think our communications and our branding have really helped with selling the ACES concept across the county. So and you can see the 4 recommendations in the paper in front of you. I'm assuming you've all read the paper, so I'll stop here, and I'm happy to take any questions that people might have.
Thank you very much, Sarah. I mean, I am so proud of this initiative. I think it's been taken forward with such energy and been received so well by so many people, both locally and internationally. And it's one of those innovative approaches that we can all be rightly proud of. I've made heavy print note about strategic issues related to finance, which I think, as you rightly say, is a theme for all of these papers. We have to work out how to carry on and how to actually sort the funding out. Are there any questions from board members to Sarah about the ACES paper?
Could I just say we absolutely support the ACES paper. Can you hear me? It's Mary. And we'll have a series of funding issues coming forward to all of these papers today. I think we need to take them in the round and take them away and come back with a recommendation to the Health and Wellbeing Board, because we won't be able to deal with them all in isolation today.
Totally agree, Mary. It's a whole county issue and we need to have a strategic conversation about it. I agree. But outside this meeting and then bring it. I agree. Any other comments from board members? No, thank you. We have a set of recommendations on the paper on page 11. Generally, action centred in relation to the work going on, and the finance one we'll deal with separately. Members are in agreement, we'll move on.
Chair, can I just come in now? I think what I wouldn't want today is for us to be the finance and how we resource all of these priorities is really important. But I think with all of them, there are still things that we can continue to do. And one of the things around ACES is championing ACES. And I don't think it's ever been so important, because this is, although it's called adverse childhood experiences, we know that ACES can cut across a whole lifetime and across the life course. And I think championing ACES, and when we're thinking about commissioning services or how we consider our recovery from COVID, I think that it's really important to consider ACES, because I think it's that's a way of thinking. Well, I think someone needs to go on mute. There's quite a lot of feedback. Mary, I think this might be you. Mary. Thank you. And I think if we could just remember that we've got this fantastic programme in ACES, and whilst it might not be very visible at the moment, the work is going on the ground, and just to consider that when we're thinking about some of our strategic direction of our organisations would be a bit of a plea, I think, from the panel. Thank you.
Well and clearly heard, even with the interference. Thank you very much, Sarah. Thank you for standing in for Rhiannon. Okay, so we'll now move on to item 9 on the agenda.
Chair, sorry to interject, but we
kind
of glossed over whether the board members approved of the recommendations in that last ACES paper.
Oh, my apologies. It's the interference. I couldn't quite hear. So members, in terms of the ACES paper, can I draw your attention back to the recommendations? And if I can have some indication that there's agreement that we carry them through. Yeah, I'm looking at Andrea because I can't see
What's the thumbs up there, Chair?
Yeah, okay. Thank you very much, members.
Sorry, Carol, it's Deborah. I just wanted to come back to Mary's point, because the third recommendation is asking us to provide resources, and I think we've said that we're
Outside
in principle, but that we have to do that outside the meeting. So I don't actually think we can sign off that third bullet in its entirety today, beyond noting our support for the programme. The other three bullets are fine.
Fine, thank you. Thank you.
Sorry to be.
No, thank you for that.
Voice of doom there after such a positive paper.
Because I tend to see resources as not merely money. You know, it's the culture of actually providing people to actually and to continue.
Yeah, absolutely.
So
absolutely.
Okay. Andrea, could you make a point that bullet point 3 on the ACES paper, agenda item 8, and
I think it's a helpful qualification, because I think we are all committed to providing resources in terms of our people and our support. So I think it is just teasing out that financial resources need further discussion.
Yeah, I agree.
Yes, I can do that, Chair, in a minute. No problem.
Right. Okay, if we move on to agenda item 9, which is healthy lifestyles. Sarah, you.
It's me again. This is my last presentation for you today. So I'm trying to turn my video off. Okay, so the healthy lifestyles priority was one of our 7, and we agreed to focus initially on healthy weight. And there are some obvious links here with the physical activity and mental wellbeing priority. And back last autumn, the board received a presentation from Sue Weaver, and that outlined our approach to healthy weight in the county. And part of that was a statement of strategic intent. I've put a link in the paper for you, and we approved that as a board. And it really builds on the work that the public health team and the CCG have been doing for the past sort of 7 years, really, to tackle obesity. And you'll see that in Appendix 1 that we've got quite a wide range of programmes aimed at individuals to help them lose weight or maintain a healthy weight. And what the statement of strategic intent does, it outlines that whilst that's helpful, and we've been doing that for many, many years, and we've had some degree of success with it, but the evidence tells us that what we need to do is really look at the root causes of obesity and make healthier choices the easier choice to have, and take that almost beyond the responsibility of the individual. And we talk about obesogenic environments and environments that don't make it easy for people to live a healthier lifestyle. And this uses a whole system methodology, and some of the public health and CCG staff were instrumental in being part of a national pilot to really test this methodology with respect to obesity. And I think what you probably need is a bit of both. You need the whole system's obesity work to really stop, to prevent obesity and tackle those root causes. And you also need those individual programs to help people that really are in the right place to try and manage their weight. And I think it's the whole systems approach that we've really got to develop in Gloucestershire. So as I say, you've already approved the healthy weight statement, and there's a short summary in the paper. We have a governance structure, and again, my team have been diverted away from this for the last 6 months, but we're hoping to resurrect this in the autumn, or if not shortly after Christmas, as it has been paused. But that was well attended, and we think that we could really easily bring that back to life. And I think, again, there's the issue of resources for us. We don't have any dedicated resource to take forward this whole system's work. I think we've got a clear idea of how we would do it and what we need to do, but we need some resource to do that, and that's outlined in the paper. The other resourcing issue we have at the moment is that we have a really, really good children's weight management programme that has been funded by the CCG up until, I think it's the end of March, and we're just looking to see how we might continue taking the learning from the pilot and commission that in the longer term, because that's been working in some of our more deprived parts of the county with whole families to try and get to those root causes of why people are overweight and helping them choose healthier lifestyles and healthier diets. And we've had some really interesting results and some great feedback from the families we've been working with. So I'm taking that forward with Tim Harmer, my cabinet member at the moment. And we've had a lot of support as well from Children's Commissioning in the County Council, and Richard Balls, the cabinet member for Children's. The metrics that we're planning on using are highlighted in the paper. I think just to note that the National Child Measurement Programme has been paused and will be paused for quite some time. We think perhaps the next 18 months. So we won't be having a reliable source of data for children's weight management for quite some time. Although anecdotally, we're having a lot of feedback that children are going and returning to school, and some have put on significant amounts of weight during lockdown. So I don't think there's ever been a greater need for us to have a healthy weight programme in Gloucestershire. So I'll pause there, and I'm happy to take any questions.
Thank you very much, Sarah. COVID's got in the way of so many things, hasn't it? Any questions from board members for Sarah about her paper, the paper Healthy Weight Priority?
Can I just make a comment, Chair? We've been considering, we've been saying COVID has got in the way of quite a lot of our work, but COVID has brought into sharp relief the impact of being overweight on our health. And as a result, a lot of people are more aware of this and more focused on losing weight and taking more exercise. I wonder, is it time for us to do some sort of media campaign on this? And we're talking to GPs about this as well, to understand how we would really just take advantage of this whole issue really now and engage with our population.
Sarah, do you have any comment on that? About
I agree that would be helpful. I think where I am at the moment is that my team are still responding, so we're still dealing with outbreaks, and my lead, Sue Weaver, is actually been really helpful in terms of driving some of that. So it's the difficulty of trying to take people away from the response, and I can't tell you how much some of my team would like to return to their normal jobs, but there isn't the money in the budget for a focus on obesity all the time in my team, and I think we would want to be able to support that. That's not to stop other people from doing it, but we need to understand, well, what would a local advertising campaign add that we haven't already got from the new PHE campaign around managing your weight in the light of COVID. So I think it's a really difficult situation. I can't release my team from response at the moment. It has to be our #1 priority, I'm afraid.
Understood, Sarah. It might be that we need to have a discussion outside this meeting and just see what we can pull together.
Agreed, yes.
Thank you. Thank you, Mary. Any other comments from board members?
I'm not seeing any hands up, Chair.
No, thank you, Andrea. If I take members to page 21 then on the paper copy for agenda item 9, the recommendations are twofold: to note the progress to date and to note the need for additional funding, as we've talked about before. So that's recommendations. So I take it that we note those two things. Yeah.
Yes, I can't see any objections, Chair.
Thank you very much. Right, romping on. Agenda item 10, dear to my heart, mental health and wellbeing strategy.
Hi, thank you, Chair.
Sorry.
My name's Eddie O'Neill. I'm here in place of Angela Potter.
Yeah.
As you probably guessed, I'm not Angela. I'm Deputy Director of Strategy and Partnerships here at Gloucestershire Health and Care Trust. So I've been asked to come along and present the paper, which provides an update on the mental health and wellbeing strategy for Gloucestershire. The strategy is a 5-year strategy, which is all age life course, runs from 2018 to 2023. It's very much a multi-agency effort and builds on very much the legacy and partnership working within Gloucestershire, bringing together a range of different partner agencies to work collectively across a range of different work streams. Strategy covers cross-cuts, early intervention, prevention, treatment and care. The governance arrangements within the county are set out within the paper, and the strategy has been developed and overseen by the Mental Health and Wellbeing Partnership Board, and there's a number of different work streams that you will see within the paper that feed in to the strategy. There's 7 different themes that address all of those different aspects. I won't read them out. I think they're set out relatively clearly within the paper. In terms of progress, there's a range of different performance indicators across all the different aspects of mental health and wellbeing services, but the commissioning team are currently working on a dashboard that will help us to see progress across the delivery of the different parts of the strategy. Clearly, over recent months, COVID, as is the case with everything else that we've discussed this morning, has had a significant impact on the delivery of services, and there's been specific arrangements put in place as part of the incident management for COVID, and there's 2 particular work groups that have been set up to oversee those arrangements as we go through this particularly challenging time. Those work streams include targeted support for vulnerable groups, workforce wellbeing, suicide prevention, recovery in both statutory and non-statutory services, and the work around demand modelling is ongoing with an anticipated surge and mental health needs within our population, and preparations are ongoing in respect to that. I think that probably covers, it's a relatively brief paper that highlights just the key points for the board to consider this morning. The recommendations are to consider the issues within the report and to also consider how the board might further support joint working around mental health promotion and the interdependencies with the other priorities within the health and wellbeing strategy. Clearly, it's already been identified that there's a link with the healthy weight priority. I'm sure there's other more cross-cutting interdependencies with mental health and wellbeing across the other work streams. I'll pause for now, Chair, and do my best to answer any questions if there are any. Thank you.
Thank you very much, Eddie. My hesitation in addressing you by name is because initially you came up as Angela and then you spoke, and I was sure Angela's voice wasn't quite as deep as your own. So thank you very much for presenting the report. I open it up to the board, really, if there are any questions, particularly on how the board might further support, which is part of the challenge in the recommendations.
I'm not seeing any hands up, Chair.
Okay. Neil, do you have any particular thoughts on how the board might help you further to actually integrate this issue with the other priorities?
I think you mean Eddie, Chair.
Do I mean Eddie? Who did it want to say? Sorry. I can't hear.
Sorry, Chair, I was looking through the list of names there to see who was
My apologies.
invited to respond. I think that in reality, sitting underneath this board is a very well represented mental health partnership board, which does have representation across all our key partners. So there's very much a cross-cutting approach to the development and implementation of the strategy, which takes into account the wider determinants of poor mental health. So I think that it's a very well-connected strategy into a range of other work streams. That's through the local authority and the clinical commissioning group as part of the clinical programme board. So I think that there is a degree of assurance there to the board that in terms of the interdependencies across the 6 other themes or strategies, there is good connectivity there.
Thank you very much, Eddie. Any further comments from members of the board?
I think Sarah and I have got our hand up, Karen. I can't find how to put my official hand up, so I just keep waiting.
And I have very poor IT. I'm having trouble hearing people. Debbie, please carry on.
I just wanted to acknowledge it's sort of a word of the moment, but this notion of anchor organisations or anchor institutions, and I suppose it's just to remind all of us of the opportunities, I suppose, our responsibilities as very significant employers. Certainly, some of us, myself, obviously, in the council, of our what we can do to just role model in this place and to do what we can, particularly I think around our workforce, because that is, they're in a particularly challenged place at the moment for the reasons we're all very, very aware of. But you can pick it up in any one of those themes. But I just think this notion of us as anchor organisations leading the way and describing and promoting all that we're doing would be a good approach, not least because I think we are doing an awful lot in this space.
Sarah, did you want to come in on that?
And on similar lines, really, I think the work we've done during COVID has really shone a light on some of the need for some additional mental health services. So I think, like Eddie said, there is a strong partnership that sits beneath this board. I don't always think we've had the feedback to this board, so mental health was a priority in our former strategy as well, but I don't think we had the connections quite right. And I think that's probably we've probably cemented those in a stronger way throughout our response to COVID, both through the LRF mental wellbeing work and the work that was led through the NHS NHS goal and COVID response. But I think now what we need to do is really make sure we get a good reporting line into this board so we're all aware of what's happening, because I think there's a lot of work going on and it's easy to miss some of it. So hopefully now with this as a new priority, we'll be able to make sure that happens.
Thank you, Sarah. Thank you, Deborah. I think it's one of the more positive things that have come out of the COVID response is that we have actually better lines of communication, and we need to capitalise on those.
Yeah. Could I just...
oh, sorry.
I was just going to comment on the both points, actually, with regards to workforce, as Deborah's outlined. I don't think there's ever been more of an important time for us to pay attention to the mental health and wellbeing needs of our workforce. That's across the whole system, not just within our statutory services. And there is a specific work group looking at the workforce needs, and I know that there's been a range of different initiatives going on within each of our individual organisations, but collectively that work has been overseen by a working group to look at how we can further develop support to meet the mental health and wellbeing needs of our workforce. So very much welcome the points from Deborah, and I will feed that back to that work group. On Sarah's points, I think that public health have really stepped up to the plate in the last number of months and commissioned some specific support services in the early days of the restrictions back in late March and in April to provide additional psychological support to both children and adults within our population using digital platform to enable easy access for people within our population that's needed additional support through what has been an extraordinary time for us. So yeah, points very well made. I'll feed them back to the partnership board and the work streams. I think the paper today aimed to just give a high level overview of the strategy, the themes and the governance arrangements. There is a range of, there's an action plan supporting the delivery of this strategy, which is incredibly comprehensive. And there's a list of almost 100 different specific actions going forward to support the achievement of the strategy objectives. So perhaps further future reports can give more specific detail on some of the initiatives that are going forward.
Yeah. Thank you very much, Eddie, for that summary. and thank you for feedback, members. So the recommendation is to note...
Sorry to interrupt you, Chair. Andrew Miller has put his hand up.
I'm sorry, Andrew, I couldn't catch that.
Andrew Miller has put his hand up.
Okay, thank you. Andrew.
Thank you very much for this, Addy. I think this is an incredibly important topic, and it's just for a bit of background to the rest of the board. I chair the Children and Family Overview and Scrutiny Committee, and I've also been the champion, I think probably still am the cabinet champion for care leavers. I'd like to ask about a couple of things, related issues. One is kind of resources and the level of mental health support that's available. I'd like to ask about CAMS, the Children's Mental Health Service, and also about whether or not we can get prioritisation for children in care and care leavers who often have quite serious mental health issues, and about the transition for care leavers from children's mental health services to adults' mental health services, and whether or not we can get a smoother transition. I wonder if you could address those questions.
Thank you, Andrew. With respect to our CAMS service, we are in a relatively fortunate position within Gloucestershire, whereby we've been selected to take part in both aspects of the National Trailblazer programme, which is around mental health support teams within schools. And currently within that pilot, we have got specific mental health support in 72 of the county's schools as part of that pilot, which at this point has been very, very well received and achieving some good outcomes, although we need to wait to the end of the pilot period for a full evaluation to take place. The other part of the Trailblazer programme has seen considerable extra investment into our specialist Tier 3 community mental health services for children, which is moving towards testing whether a 4-week waiting time referral to treatment standard could be achieved, and whether that is indeed the standard that will be adopted on a national level. We had a difficult period last year when we took on board both those Trailblazer programmes because of the workforce challenges and the difficulty in recruiting into those specialist posts. However, over the last year, we've had considerable success in recruiting new staff into the teams, and our waiting times have reduced considerably as part of the CAMS offer. In terms of transitions, there's a specific piece of work ongoing to look at a service model that will cross-cut between children and adult services. Whilst it's in its early days of that being developed, reports suggest that transition arrangements have improved, not just within specialist services, but across the range of different services within the overall pathway. I'm sure that there is still some work to go, and at a national policy level, there's a lot of interest in the model that Gloucestershire is looking to develop to try and deal with what has been a long-standing issue, whereby children, when they get to the point of becoming an adult, will experience a different culture as they move from a children's service to the adult services domain. So I think there is some work going towards improving that. I do believe that there is further progress to be made.
Do you think 4 weeks is ambitious enough for children? Remember, for children, 4 weeks to me is nothing, but 4 weeks to a kid is a huge amount. Do you think that's really ambitious enough? Can we go to 2 weeks?
There has been no decision made that I'm aware of at a national level what standard we will end up with regards to a national waiting time. As part of the pilot, we were asked to move towards a 4-week wait as part of that pilot process. I just have to acknowledge that within that, any child that presents with acute needs will be seen within a far shorter time frame. In fact, within a 24-hour period in most cases for emergency or urgent referrals is something that we've worked towards for a long time prior to the pilot that I've just described. So for those that have got an acute and urgent need, they're seen within a much shorter time frame. The 4 weeks wait standard is the sort of the generic response for those that are considered having less severe needs.
It is, Carol. Thank you very much for that feedback. I would suggest that it may be helpful for you to talk to Dr. Miller outside the meeting just to get further clarity, and he may indeed want to bring it to his scrutiny committee as a separate paper. Thank you very much for that feedback.
Chair,
really helpful.
Chair, if I may just inform the board that I'm actually meeting with Eddie and Helen Ford on Friday, and we're going to be starting to scope out a series of workshops for starting with children's mental health, which have been commissioned by the Children and Family Scrutiny Committee, and obviously we'll be working with Health Scrutiny. But we're going to be looking at a series of workshops across the whole life journey. And if board members want, I will keep them apprised of any dates that are coming up if they wanted to dip into those meetings, because they will be very welcome.
Thank you very much, Andrea. That would feed into the debate quite nicely. Thank you. Right. If it's all right with members, we've noted the recommendations, have we, Andrea? Paper 9.
I think we kind of glided over it, but yes.
I think we have. Lots of discussion, which is great. So if we could move on to item 11, which is social isolation. I've got Mary down here and I've got Chris Brearley, but I'm not sure if Chris is still in the meeting.
I'm still here, Carol.
Oh, great. Nice to see you.
You too.
Thank you, Chair. I said I would start this, and then Chris will obviously tip in. As you are aware, this is a joint priority through the ICS Enabling Natural Communities Group and Safe for Gloucestershire. And we have attached to our brief paper the deep dive which we commissioned last year and has been presented last year to the Health and Wellbeing Board. And that was in May 2019. And the purpose of that deep dive was to open a conversation on loneliness and social isolation, and to consider the difference and the impact of those two issues. And we acknowledged during that deep dive that an individual can be socially isolated and not be lonely, and conversely can be lonely even if they're not socially isolated. So we in the paper we also identified a whole series of interventions which are in place across our system, which are targeted to addressing loneliness and social isolation. And they range from the work that neighbourhoods are doing to the wellbeing in the workplace, community wellbeing service, social prescribing, and a whole other range of initiatives. And we wanted just to really explore the extent of the work, and there is an enormous amount of work ongoing. Of course, COVID has cut across quite a lot of this work, and therefore we decided then to look in August at the deep dive document, have a discussion on how COVID has altered the experience of many of our citizens, and change our thinking. And we want to think through how we continue with the work in the medium and long term, but also how we address some of the issues that COVID has put in place for our citizens, and come up with a plan. So now we've established a short life task and finish group to develop our thinking. We'll produce a joint statement and a plan for our next steps as a partnership. At this stage, we haven't outlined a set of resources needed. There are quite a lot of resources already at play in this area, and a huge number of partners involved. But inevitably, that will be part of the work that we complete as part of our task and finish group. Chris, do you want to add anything to this?
Yeah, just to build on what Mary was saying, and thanks to Emma Savage for the work that she's done previously. I think we came a long way, and then obviously, like everyone's saying, with it, a lot of the priorities that COVID got in the way, but I think it gives us a great opportunity now to kind of take stock and, as Mary said, enabling active communities. There's a task and page I'm involved with that. I just think we've got a really good opportunity now because there's lots of pockets of good activity, dealing with social isolation, resilience in our communities, and I think this is now the time. This could be a really exciting project going forward. So whilst it's not lots of firm recommendations here today, I think it's a sense of the direction we're going, Chair.
Thank you both very much. I mean, I was really excited by this paper, not least the notion of resilience, not only within the organisations to actually revisit this, but within a level of resilience to COVID that's actually helping us to actually get a better idea of how people are coping and where we go forward with this. So thank you very much for the paper. Anyone have any questions for either Mary or Chris?
There are no hands up on the system, Chair.
No one looks as though they're indicating. But thank you very much. I look forward to having some feedback about what the task and finish group comes up with. That'll be really interesting. So look forward to that. Thank you very much. And if you'd thank your teams, that would be really helpful. The recommendation we have on page 33 is to support the task and finish group. I think we certainly do in resource terms and actually thinking. So we wait for the feedback on that. Yeah. Thank you very much, Board. We'll move on to the next paper. I feel as though I'm running a race here. It's ridiculous. Paper after paper. So the next paper we have is paper 12, Early Years Best Start. And we've got Andy Dempsey talking with this one, who I see.
Thank you, Chair. You can hear me. I won't go on to the video because it does interfere with. Can you not hear me? I saw Andrea shaking her head, but that might just be my presence that's offensive to her personage. I won't go through the paper. I presume you've read it. There's some really good work going on in this space. There's actually been two groups, the Improving Outcomes for Early Years and the group which has emerged under the auspices of Child Friendly. The key proposal in this paper is to merge those groups, building on the really good work that Beth Bennett-Britton has led on Sarah's behalf. It's comprised mainly of the statutory agencies with some voluntary sector input. The other group has more of a voluntary private sector involvement, which reflects the early years provision and the early years provider market. So the next step really will be to merge those groups and take stock of where we are. One thing, there's been a good deal of discussion about the impact of COVID. The most obvious one I can see is that there will be an impact on the provider markets. There's over 700 childminders and nurseries in the county. They work on a marginal funding model based on a universal offer for 3 and 4 year olds and a targeted offer for 2-year-olds. Clearly, the focus has been on the take-up of vulnerable children. They've now opened for universal provision, but depending on how the next few months play out, obviously the need for that provision will depend on what's happening in the wider economy. And I've certainly flagged that in the economic recovery plan for the county that colleagues are leading on. So I think where we are, there's a huge amount of work going on. We'll merge the groups into a single group, which will reflect the rich diversity of agencies working in this space. It's everybody from pre-birth agencies through to private voluntary and independent sector providers. It will progress via that group as part of the Child Friendly initiative. But I think the big challenge we'll have in the next 2 or 3 months is to take stock of where we are in terms of the impact on the provider market. We do have a duty under GCC to undertake what's called a sufficiency assessment of childcare provision. And we've started that work. We've done an initial paper. Happy to take any questions. And I would say what's been really heartening in terms of bringing the two groups together was there was already good overlap between the groups and a real sense of purpose that they want to work together as a single cohesive group. The other thing we'll need to do is really map out activity and understand what's happening in this sector and whether the pathways are navigable for families, because one of the things that jumps off the page for me is the low take-up of the targeted 2-year-old offer, which has been shown through what's called the REACT process, which is our weekly dialogue with the DFE. So there's a piece of work we can focus on there. But I'll pause there, Chair. I'm happy to take any questions from colleagues.
Thank you very much, Andy. I too share your concern about the age 2 cohort and the take-up of services. So I open it up to the board for questions. I've got Claire indicating. Sorry, Sarah indicating.
I often get called Claire. I don't know why. I think I must look like a Claire. I just wanted to say that I really welcome this. I think for quite some time we've needed a more systematic approach to improving the health and wellbeing of children and young people. And I think this really gives us the umbrella for it. And pairing it up with a child-friendly approach, I think makes perfect sense to me. So I really welcome it. I know it's been quite a lot of work for Dame Janet and Andy as well, but I think it's a really, really positive start.
Thank you, Sarah. I think at this point I can recognise the amount of effort and work put into this, not only by Dame Janet and Andy, but also the groups involved. And for me, it makes absolute sense that these two groups merge because there is such overlap, and it can only improve the outputs, I think, so that we can map activity and know exactly where we are and where we're going. I can't see anyone else indicating to talk, Andrew, unless I've missed it.
Chair, I was just going to comment. I think it's good that this is agreed, because we do need a really focused piece of work. It will be good to identify fairly quickly the significant areas of our priorities or areas of concern, so that we can all get behind them, because there is a lot of work in this field happening already, but it will be good to get it focused and to be able to challenge ourselves to really tackle some of those issues. And I suspect there'll be a need to look at this at place level as well as Gloucestershire wide, because there'll be very differential take up in different places.
Could I come back on that, Chair? I think Mary's absolutely right. One of the emerging impacts of COVID, it's not equal across the county. Some of the drop-off in provision in certain localities may be an issue we need to grapple with. And I'd also, just to reassure Mary, is I think the first task of the group is to stock take where we are. You know, what's effective, what isn't effective, both in terms of place, provision, take up, and then probably seek a mandate for this group, you know, to really direct the work of the group going forward.
Could I also say that we did undertake a really detailed needs assessment for children and young people about a year ago. So there's quite a lot of work that's been done. Obviously, this needs to be reflected in terms of the work on COVID as well. But there is quite a strong foundation to build upon. And that did make some recommendations around priority areas of work. So there's quite a lot of work that's already been done for the group to draw upon.
So this seems an obvious priority for the group, to actually identify what the priorities are, to add in all the new information that we have and go forward. Yeah, it's a sound strategy. No further comment? Okay, so if we go to page 74, we have recommendations. The Health and Wellbeing Board is asked to note the report and agree to merge the Improving Early Outcomes for Children Working Group and the 0 to 5 year subgroup that has been meeting under the auspices of the Child Friendly Gloucestershire Initiative into a single multi-agency group. I get the general feeling from the discussion that that's definitely where we need to go. Yeah, I'm just seeing nods of agreement. Anything other happening? Okay, we agree that then. Yeah, thank you very much for the report. We could move on to item on the agenda 13, which is housing and health. I'm not sure who we have to present this. Andrea?
John McGinty is substituting for Anna, so we'll be presenting on this.
Thank you very much, John.
Can you hear me, Chair? Jen Taylor has actually volunteered to present this report, so I'm going to hand over to her if that's all right.
Yeah, of course, thanks. So I'm presenting this paper on behalf of Anna Brinkoff, who is the board lead for housing and health. And the paper that you've got in your packs today was originally due to come to the Health and Wellbeing Board in March, but of course that meeting was cancelled. So we have updated it slightly, but it really is the update that you would have received in March. So board members may remember that you agreed back in 2019, almost a year ago, I think, that we would focus on 3 particular areas of housing. So recognising that it's quite a busy space, that there's a lot going on, and that housing is quite a broad subject. But on the basis that we felt these were the 3 areas where the board could add most value to what was already happening and kind of escalate our ambitions around housing and the impact that it has on people's health. So the board agreed that we would focus on 3 areas. Those are ensuring that new housing development promotes good health and well-being, bringing existing housing stock up to a good standard, and finally providing a diverse housing offer. And I think it's fair to say that when we did go into lockdown, we had been building quite a good momentum around action on those, particularly the first 2 areas. So the first area around influencing new development, we've done a considerable amount of work to start to get health really in the vocabulary of our planning colleagues, so building really strong relationships with planning colleagues and district councils, and starting to influence local plans and planning policy, as well as major developments. So some of those big strategic sites that you will be aware of around around Cyber Central in Cheltenham, the Ashchurch Garden Village, and so on. So really trying to influence there. We'd also developed a methodology for carrying out a health impact assessment around local plans, and we tested that in Stroud. Stroud District Council really supportive in testing that out and trying to learn from that. So we were having some really practical impacts on influencing around new housing development, and we hope to be able to restart that really when the COVID response work has settled down. Of course, board members may be aware also of the planning white paper that's currently out to consultation, and we will clearly be watching that closely to understand the impact that will have on health and well-being of our populations. The second area, I think, is where we had really built up some momentum around bringing existing stock up to standard. So you may be aware that we took part in a Health Foundation and Design Council piece of work earlier this year, so led by Anna, but with input from Stroud District Council, from Cheltenham Borough Homes, from the CCG. We worked on proposals to really upscale the efforts that are already in place to tackle damp and cold within people's houses across the county. So recognising that there's already been a lot of work done, but there's still that kind of really sticky sector of particularly private sector housing where we need to really understand the current level of housing conditions and put in place much more proactive action to bring those up to speed. So we had in March intended to bring a proposal to the board to drive that forward and to commit to driving that forward. Clearly that work has been on hold for the last 6 months and we haven't restarted it yet. So I think we would welcome coming back once that work has restarted to discuss the ambitions of the Health and Wellbeing Board, both to kind of escalate our ambitions around new housing development, but also around what we can do about existing housing stock. So I think that covers most of the paper as we are where we are at the moment. I think it's worth just mentioning that we had agreed back in September last year as well that we would delegate the lead of this to the Strategic Housing Partnership in the county, which is made up of the relevant directors from the local authorities to kind of hold this piece of work. But that where the Health and Wellbeing Board, I think, can add value is really setting out that ambition for a step change and being willing to change the conversation, I think, about what we expect from housing and its impact on the health and wellbeing of our population. So that's all from me.
Thank you very much. A really comprehensive paper. It's one that I've had to read several times really to see the full impact of it. I think the pickup of further work is going to be so crucial. Some of it got halted so abruptly when people had to change what they were doing. It's one of those things that if we could have turned back the clock and started it sooner, it would have been so much more in evidence now. But we can't do that, and we move on. So, Jennifer, can I just ask you in terms of actually where we are with this paper? Do you anticipate picking up on some of the areas that are incomplete, that need further work in a sort of seamless way, or do you think that's going to need some sort of very specific effort to get it on track again?
So I think talking to Anna last week, I think Anna's very keen to pick up the proposals that were developed as a result of the Health Foundation work. So that's that kind of second strand of work. So she's very keen to pick that up again, and I know has been in touch with the working group that was involved in that to be able to restart that. And I think that really was paused, very much sort of left left frozen in time, and I think it is something that we can pick up and work with, be it with slightly less public health input at the moment, but there was really good engagement from other partners across the Health and Wellbeing Board. So I think that is I think that's doable. From a personal perspective, I think some of the work around influencing new housing development will be more challenging, given that that was really sitting with the public health team, and that has been challenging in that we haven't been able to prioritise that and may not be able to whilst our response work is ongoing. But of course, there is continuing work as well in the report under the providing a diverse housing offer, and I know that the Housing with Care programme board, for example, is meeting, and some of that work will continue as well. So I think the one area that I think may take a little bit longer to pick back up is that area around new housing development. That said, I think we did a really good job collectively of embedding that in some of our planning teams' thinking. So already I know that our planning teams are thinking about health and wellbeing, and actually that influencing work was kind of good ground laying for this now. Obviously, depending on the outcome of the planning white paper and what that might mean for us in the future.
Thank you very much for that clarification, Jenny. Would any board members wish to comment?
Yes, I'd like to comment this, Mary. I'm not sure how to use the official hand, so I have to wave. I think this paper undersells the work that housing is doing, actually, because I'm aware of quite a number of the projects that they're doing, and maybe that's the Housing with Care group and the work around disabled facilities grants. And I've been absolutely thrilled about the work where they've been able to put a worker in to work with patients who've got cancer, to support them with their needs. And that has been absolutely transformational, the work around the homeless. And I didn't think that work had actually stopped now. I think that work is pressing on. And I think, you know, we ask in the paper about asking the Health and Wellbeing Board to support a step change in action to improve existing housing stock conditions. I think there has been a really significant amount of work done to improve existing housing stock conditions. So could we have an update on that aspect of the work that's happening? Because I think that would be very encouraging for the board. And it really fits in with our work on health inequalities, because there is a huge amount of focus on the areas of inequality inequalities. And I would just really commend to people the work that the team have done together using the Civil Facilities Grants in a different way, and we need to hear about that as a board.
Good point, Mary. I hope Andrea's captured that. We'll summarise it at the end. Any further comments? No. Some excellent work here. I'm looking for any further comments from anyone. I know there's been some chatter on the feed. No more? Okay. The paper is quite comprehensive, and on page 75 there are recommendations to the board. Now they're quite extensive. Do we have any particular comments apart from Mary's comments just on an update to the committee, to the board, before I put these recommendations to members? No? Okay. So we've got 4 recommendations: to note progress, to commit to supporting, to consider and discuss, and to consider and discuss the role of the Health and Wellbeing Board in championing this agenda, which I think we're all fully in agreement with. So if there's no dissent, then I'll take those recommendations as agreed. That looks as though everyone's on board with that. Okay, thank you very much. Right, we're off the list of down to 13, and I do thank members of the board for actually reading the papers and giving such informed comments that we've had. We now move on to other agenda items, which are at 14. This is again Jennifer Taylor, down for COVID-19 reset and anchor institutions working group updates. This is a verbal report.
Thank you, Chair. Yes, so this is a verbal report because we wanted just to give you a quick update on what we've been doing following the discussion at board back in July about the impact of COVID-19 on health inequalities and what that might mean for us as a board going forward to tackle ongoing health inequalities, both in light of increasing COVID cases now, but also in the much longer term, and how we make sure that we've got things in place to address those inequalities. And with a particular focus, building on the Public Health England's report on its impact on Black, Asian and minority ethnic groups. So we recommended to the board that we took a particular piece of work away around something that Deb has already touched on, our role as partners, as anchor institutions within Gloucestershire. So our role as employers, purchasers, local leaders, and so on, and how we might use that kind of power and influence to set the agenda to tackle health inequalities going forward, but also to support local economic recovery as well, which as we've talked about before as a board, has such an integral relationship with health and wellbeing. So we have met as a small task group just over a week ago. So we brought together a small group of people, and thank you to those organisations who nominated somebody to attend. We had representation from Gloucestershire Fire and Rescue, from the Hospitals Trust, from Health and Care Trust, and from Cheltenham Borough Council, and also apologies from the LEP and from Gloucester City Council. So lots of interest in the subject, and we had, I think, probably a fairly free-flowing conversation about what we might be able to do and bring back to the board. And if the board is happy, I'd like to be able to bring back a kind of fuller paper once we've worked on it after that call last week. So we focused on 3 areas in the end, which we felt were most relevant to the subject at hand, and they were employment and training, getting maximum social value out of our spend, and finally local leadership. So I think the point Deb made earlier about anchor institutions was really about role modelling what we would like to see from within our communities. So we talked firstly from an employment and training perspective about a lot of excellent work that's already going on in the county. The Hospitals Trust representative talked very passionately about opportunities to be able to progress staff, to support staff from BAME backgrounds to progress through the organisation. And other colleagues talked about the importance of visibility at a senior level of those from a BAME background, so that people could actually see that their kind of career prospects are there for them, and to support the retention of staff. We also talked about the kind of things that restrict people from accessing employment with us, ranging from an understanding of what sort of careers can take place in some of our organisations, through to some of the kind of the technical aspects of actually applying for roles without additional support and confidence. So we know that a lot of work is already going on across the county to tackle that, but we felt there were a few things that could be delivered that might help to really enhance our role as anchor institutions. And one of those things was some work that a colleague is doing and has reported previously to the ICS board around this idea of an inclusive employer approach. So actually how we demonstrate that as employers we are inclusive and lead by example. So secondly, then we also talked about social value, and Cheltenham Borough Council shared a bit of information about their recently adopted social value policy. And we talked about the opportunity that we think we've got in the county to align our social value policies much more closely with the objectives and the ambitions, whether that's organisational objectives or whether that's system objectives, perhaps led by the Health and Wellbeing Board. So how do we make sure that social value isn't just an add-on, that when we procure a service, we are also procuring those outcomes, and that they are not just a kind of a side effect of what you've bought. And we've seen examples from elsewhere in Birmingham and Cheshire and Merseyside of health-led social value charters, which we think we could potentially build on in Gloucestershire. And finally, we also talked about local leadership. So that was really that bit about leading by example. So committing to and being really clear about what it means to be an anchor institution, what they look like, how they behave, and really spelling that out. I think we collectively had a broad understanding of anchor institutions, but we couldn't necessarily describe how an anchor institution in Gloucestershire acts or behaves. And we think there's a real opportunity here for us to set out a kind of framework or set of principles that we sign up to as a board that say, this is how we act, this is how we employ, this is how we purchase services. Some broad principles that I think people can collectively sign up to and then implement themselves within their organisations as is most appropriate to that organisation. And we also suggested that local leadership might involve having some quite difficult conversations about particularly the disproportionate impact on residents from a BAME background, and some difficult conversations about representation at a senior level. So we talked about the National Colour of Power Index, which some of you may have seen. I'd recommend Googling it. It's a fascinating visual representation of those who are in positions of greatest influence in the country. And it speaks volumes. And I think it was something that got the task group really talking about what representation looks like in Gloucestershire as well. So we had a really positive and wide-ranging conversation, as I've just described. And as I say, I would welcome an opportunity to come back with a written report and some proposals, perhaps around the proposal around a set of anchor institution kind of framework or of principles, But I think we've made some really good progress there. To finish, the two other pieces of work that are going on in the background are the Director of Public Health annual report. So that we mentioned in the paper last time is focusing on Gloucestershire's response to the PHE report on the impact of COVID on BAME communities. And we're planning to launch that hopefully in line with Black History Month in October. So it's with the designers as we speak. To really promote and hold a mirror up to the county and how we respond both immediately and in the longer term. And then finally, the health inequalities framework, which has been touched on earlier in this meeting, is also in development, and of course will be brought to the Health and Wellbeing Board in an appropriate time. So I think that summarises it. Thank you.
Thank you very much. I'm really excited about the work of the working group. It seems to have been a long time coming, but all of a sudden the opportunity is there and the moment's right. So, and you've done a huge amount of work all so far. I mean, I'm very, seriously impressed that people have committed to this level of time and effort at this time. So well done. So we now need to move on to get some action done. That's the next key bit. So I've got Sarah indicating. Do you want to come in, Sarah?
Yes, thank you, Chair. Just to say thank you to Jennifer and to Zoe, because what we asked them to do last time was an incredibly broad task, and they've convened a group. And Jen and I have caught up about this, and I think it could have gone in any direction, and you've managed to come up with 3 clear recommendations. I think those principles for us as anchor institutions will be really, really helpful. So I think to come back with some clarity is firstly impressive, but actually I think it would be really, really helpful. And it gives us something much more tangible, I think, to move on forward. So thank you.
Any other excuse me, any other board members wish to make comment? Lots of chat, very positive. Thank you. Okay, Jenny, we look forward to a written report in the future. And I'm really pleased that, with the Public Health Director's report coming through for October at an opportune moment, and the framework coming through as well. Really good. Thank you very much. So we look forward to a written report coming to the board when it's appropriate. Thank you very much. Now then, we're moving on to item 15 on the agenda, which is Child Friendly Gloucestershire Update. This is Andy Dempsey and Dame Janet Trotter.
Thank you, Chair. I don't know whether Dame Janet wants to speak first and I'll follow.
No, if you carry on, Andy.
Okay.
Okay.
I'll be brief, Chair, again, because I presume people have read the reports. This is probably the boring bit in the process, in the sense of there's always a need to get the bureaucracy and infrastructure right before you embark on a serious endeavour. The last Partnership for Children, its passing wasn't mourned, neither was the plan missed. And I think there's a lesson for Gloucestershire there, that you want to formulate something that's exciting and aspirational for children in the county. This report sets the next steps in that journey, that we really need to reconstitute a partnership group that is looking at the well-being of children in the county, and that is distinct from the already well-established arrangements for safeguarding children in the county. Paragraph 6 of the report sets out the strategic purpose of that group. As it acknowledges in paragraph 7, it would ordinarily be the case, due to the statutory obligations placed on the Director of Children's Services or the lead member for Children's Services from a political perspective, that they would lead this coalition. But having spoken with Chris and Richard, they felt, and I think partners have been supportive, that Dame Janet continues the work she's done as somebody who I think operates with integrity across the sectors and can bring the sectors together for this purpose, and that's set out in the report. The other key issues in the report are, we are suggesting 3 areas of focus. one of which we've already touched on, which is the pre-birth to 5 years best start in life. The second one is really coming out of COVID, and that's the transition of young people at age 16 into further education, sixth form or employment and apprenticeships. There's a need, I think, to rewire the system and ensure that coheres so that young people don't miss out on opportunities. And the final one is a cross-cutting theme around mental health. Paragraphs 12 and 13 of the report are the exhortation bit, which are, if we formulate this group, we will need good senior representation across all sectors. Some of that's already been developed through the child-friendly initiative. It's probably a bit of grafting on of some statutory agency representation onto a group that is also already well represented across the commercial, voluntary and independent sectors. Attached to Appendix 1 to the report is an outline terms of reference for the group, which is there for information and comment. I think, subject to the support of Health and Wellbeing Board today, the next steps for Dame Janet and I will be to constitute that group, to take stock of where we are and then start to embark on the delivery phase. I think that is tempered by the elephant in the room, which is COVID. Certainly a number of partners, their ability to commit to this and achieve meaningful change is informed to an extent by what's happening. Children's Services, by the way, is still in the response phase. We're rather like Sarah's team and no doubt part of the health economy. We are still in response. We need to bear that in mind. So this is really to update the board and seek a mandate both for a serious commitment to the establishment of what would be analogous to a children's partnership, to secure support to focus in the short term around those three areas and see what we can crack on with as low-hanging fruit. And at that point, Gerald, I'll hand over to Dame Janet, if Dame Janet wants to expand on what I've said so far.
I don't really need to say very much, apart from it just always seems to me when I come to this board that there's so much going on. And I think you might say, why is it necessary to have something for young people particularly? And I think when I talk to young people, they just don't see us working together with them in the centre of things. And I think that that must be our mantra as we go forward, that young people will be at the centre, and we'll try to get the services cohering and coordinated around their experience and their needs. So that's really the ambition. And I think I may have taken on more than I can chew on this one, but I'm up for what I think will be quite a difficult journey ahead.
I should have added, Chair, that Chris has committed the resources through our youth representatives and Future Me programme so that we can build an infrastructure which makes that aspiration of an ongoing, authentic dialogue with children and young people something we can actually deliver on. And I think that's the other exciting element within this project and distinguishes it from, I think, what's been attempted in the past.
Thank you very much, both of you, Dame Janet and Andy. Just a really exciting paper and coalesces all the work that's gone on through the last few years to a point where we can move on. My question was going to be out, where are the young people in all of this? And I'm just glad of the last comment, Andy, that Chris has actually committed a youth element right into it, at the centre of it. So I open up to board members for comment or questions.
Chair, can I just say, it's Janet Trotter again, that I went to meet these new young representatives a couple of weeks ago with Chris. They are the most diverse group of young people from across the county and representative of LGBTQ communities, young people who've been in special needs. So they're not the normal group who come forward. they've applied, and they're going to build up or help to build up a website that is particularly focused on young people and their needs, their wishes, and we're hoping that young people will contribute to that. So it's a really positive beginning, and I think at every stage we've got to say, what is the young person's view of this? How are they experiencing the services that we're offering? So we've got to keep that at our forefront.
Thank you for that. It's really heartening to have that feedback. For so long, services have been delivered historically top down, and we need this to actually be pump primed from young people. What do they need? What do they aspire to? And what innovation can they bring to this? Because they are so rich with ideas about how to actually fulfil the promises. So excellent team working. Really excited about it. Anyone wish to make comment? I recognise there's lots of chat going on that's all positive. Sarah?
Just because I think there was a comment in the chat about linking things to Vision 2050, and I think the three priorities highlighted do this really well, because we've talked about social mobility in Vision 2050 at Leadership Gloucestershire in the last two DPH annual reports, and that talks about the importance of things like school readiness. So that birth to 5 priority I think is really important, and then the young people to employment aspect is really important, because we have to help them gain employment and then help them gain the progression into more meaningful employment, don't we? So I think for me this we're seeing some of our priorities begin to gel together, and that's really encouraging. So I would support the recommendations in this report.
Thank you, Sarah. Mary?
Yeah, I just wanted to comment that I do really support this actually, and really welcome the time that Dame Janice and Andy have spent on this, and looking forward to having a dialogue about how we can get engaged. And obviously we do have engagement teams across the NHS who are working with children and young people, and we would like to see how we can put some of the thinking together, but the energy that young people will bring will be really valued, and I think we need to press on with this as soon as possible.
I agree. I'm into a year of action. We need to get things moving, and I think we've got so many opportunities in today's agenda to get situations moved and merged and to work together. So without further comment then, could I take members?
Sorry, sorry, I did raise my hand.
Can't hear you.
I did raise my hand, Chair.
That's fine, can't see you.
Are you?
Carry on.
I raised my hand virtually. Okay, so I think the first thing I'd like to say is thank you very much, especially to Dame Janet Prosser for agreeing to chair this. I think it's really important that there's a group like this looking at all aspects of children in our county, really, and creating a better future for 2050. Clearly, I mean, there are a lot of issues in the county. I'm, I guess, particularly interested in children in care and care leavers, but my vision for 2050 is that we have far fewer people in care, for example, and that would be part of being a child-friendly county. Dame Janet, you mentioned a diverse group of children. You did talk about special needs children as well. I hope that there's also perhaps someone in care or from a care leaver in that group. Perhaps you could confirm. If not, I'm sure we could work with Chris Spencer and the ambassadors to get someone in that group. I've got a couple of really specific questions or points. One is under the composition and the CCG/care representatives. Can we have at least one person in that group who is a qualified paediatrician? That wasn't made explicit, I think, in the Constitution. The other thing I want to say, and I guess I would say this being the chair of the Children and Family Overview and Scrutiny Committee, would it be possible to have an annual report for our Overview and Scrutiny Committee from this group, since GCC is the lead organisation. Once again, I want to really thank Dame Janet Trotter and Andy Dempsey for bringing this forward. I really welcome this report. Thank you.
Maybe I can come back on that. Those are very helpful comments. About care leaver being in the group of young people, I do know that there's a carer in the group of an autistic brother, and I think there's a care leaver, but I will come back on that and make sure that we're involved. And in fact, we're trying to link the representative group with the ambassador group so we get that richness of experience from young people. On the composition of the group, yes, to a qualified paediatrician, that is an important element. And yes, it would be good if we report back in a year's time. And I would really like to put young people at the centre of producing that annual report, so it may not come in the normal form. And I think we might be, we'll try and be innovative in the way that we come back to you.
Very much. That's a fantastic response. Thank you.
Want to come back in?
No, that's fine for me.
Thank you for your questions and thank you for the responses, Dame Janet. So if we could go back to page 92 of the report. This is the recommendations to the board. So the Health and Wellbeing Board is asked to note the report and agree to establish the Child Friendly Coalition Strategic Group. Agree 3 priority areas set out in paragraphs 9 as the basis for Year 1 action plan. I think, you know, looking at nods, we're all in agreement with this one, which is lovely. So thank you both for your report. There's agreement that the board that we accept the recommendations and we move on. Thank you very much.
Thank you, Chair.
Andrew, is there anything I have missed from the reporting process as part of the minutes?
No.
No, we're okay. And have we remained quorate throughout the meeting?
We have, yes.
Thank you very much for that confirmation. So this is a constituted group that will have minutes and actions from this meeting. Thank you very much, Andrea. Thank you very much, members, for attendance. I'm sorry about some of the noise issues. At times I've been having trouble to hear what's going on, but
thank you.
It's in this era of tech, isn't it?
Okay,
Very
Nigel,
well
can I ask
considered.
you